Do you know what arthritis is and why it's important to understand? Arthritis, often assumed to be a single condition, is actually an umbrella term used to describe over 200 distinct disorders, all involving some form of joint pain or disease. It's a widespread health issue, affecting millions globally, crossing age, sex, and race boundaries. Arthritis can be debilitating, severely impacting an individual's quality of life. It can make even the simplest of tasks, like opening a jar or walking upstairs, a challenge. Yet, it's often misunderstood, leading to misconceptions about its seriousness and the range of people it affects. It's not just a condition of the elderly, and it's not just a bit of joint pain. Arthritis can affect anyone at any age, and its impact can be profound. Understanding arthritis, its many forms, and its wide-ranging effects is the first step to managing it effectively. Arthritis isn't one size fits all. There are different types, each with its unique characteristics. Let's start with osteoarthritis. The most common form of arthritis, osteoarthritis, is often known as the wear and tear arthritis. It occurs when the protective cartilage that cushions the ends of your bones wears down over time. This deterioration can affect any joint but is most common in the hands, knees, hips, and spine. Symptoms typically develop gradually and include joint pain, stiffness, and loss of flexibility. Next up is rheumatoid arthritis. This is an autoimmune disorder where your immune system mistakenly attacks your own body's tissues, primarily affecting the lining of the joints. This results in inflammation that can cause joint pain, swelling, and eventual joint damage. Unlike osteoarthritis, rheumatoid arthritis tends to affect smaller joints first, like those in your fingers and toes, and symptoms often occur in the same joints on both sides of your body. Last, but certainly not least, is psoriatic arthritis. This form of arthritis affects some people who have psoriasis, a condition that features red patches of skin topped with silvery scales. Psoriatic arthritis causes joints to become swollen, tender, and painful. Distinctively, it can also cause patches of red, scaly skin and pitted, discolored nails. Each type of arthritis has different causes. Osteoarthritis is often a result of aging or joint injury. Rheumatoid arthritis, on the other hand, is caused by your immune system attacking healthy cells in your body by mistake. And psoriatic arthritis, it's linked to the skin condition psoriasis, and genetic and environmental factors play a role. The symptoms of these arthritis types can overlap, but there are distinctions. Osteoarthritis often leads to joint pain and stiffness, whereas rheumatoid arthritis may cause warmth, swelling, and redness in the joints. Psoriatic arthritis can lead to both physical joint issues and skin symptoms. Knowing the type of arthritis helps in formulating a targeted treatment plan. In the next scene, we'll delve into the causes and risk factors of arthritis. Stay tuned. What causes arthritis? Let's delve into the various factors. Arthritis isn't a selective condition. It can strike anyone at any age. However, certain factors can increase your risk. Age is a significant player. As we age, our joints naturally wear down, making us more prone to conditions like osteoarthritis. Next, let's consider genetics. Some types of arthritis, like rheumatoid arthritis, have been linked to specific genes that can make you more susceptible. Obesity is another risk factor. Carrying extra weight puts additional stress on your joints, particularly those in the knees, hips, and spine, which can accelerate the wear and tear process and lead to arthritis. Lastly, we have joint injuries. An injury to a joint, perhaps due to sports or an accident, can increase the likelihood of developing arthritis in that joint later in life. While some risk factors are unavoidable, others can be managed to reduce the risk of arthritis. How do you know if you have arthritis? Let's talk about the symptoms and how it's diagnosed. Arthritis often announces itself through a set of common symptoms. It might start as a slight discomfort in your joints, perhaps a twinge of pain or a stiffness that wasn't there before. Over time, this discomfort can escalate into persistent pain, often accompanied by swelling and a noticeable decrease in your range of motion. These symptoms may be subtle at first, only noticeable in the quiet moments of the day or after periods of physical activity. But as arthritis progresses, these symptoms can become more persistent, even constant. But pain, stiffness, and swelling are only part of the story. To confirm the presence of arthritis, healthcare professionals often conduct a thorough physical examination. They'll check your joints for swelling, redness, and warmth. They may also assess your range of motion and reflexes. To further confirm a diagnosis, doctors may order imaging tests like X-rays, kinetic scans, or MRI. These tests provide a detailed look at your joints and can reveal signs of arthritis, such as joint damage or bone spurs. In addition, blood tests can help identify certain types of arthritis, like rheumatoid arthritis or psoriatic arthritis. These tests look for specific markers linked to inflammation and immune response. It's important to remember that arthritis is a condition that can progress over time. Early diagnosis can lead to better management and less joint damage over time. Arthritis may not have a cure, but it can be managed. Let's discuss the treatment options. In the journey of managing arthritis, medication plays a pivotal role. It can help to reduce inflammation, relieve pain, and slow the progression of the disease. Non-steroidal anti-inflammatory drugs known as NSAIDs are commonly prescribed. They work by reducing inflammation and relieving pain. Corticosteroids can also be used to reduce inflammation and suppress the immune system. Disease-modifying anti-rheumatic drugs or DMARDs are used for rheumatoid arthritis to slow or stop the immune system from attacking the joints. Physical therapy is another cornerstone of arthritis treatment. It can help to improve joint flexibility, strengthen muscles, and maintain fitness levels. A physical therapist can tailor a program to suit individual needs, taking into account the type of arthritis and its severity. Exercises can range from gentle stretches to strength training and aerobic workouts. Lifestyle changes are integral to arthritis management. Maintaining a healthy weight can reduce pressure on the joints, particularly those that bear weight like the knees and hips. Regular exercise not only assists with weight control, but can also improve joint flexibility. A balanced diet, rich in fruits, vegetables, lean proteins, and whole grains, can support overall health and well-being. For those with severe arthritis, surgical interventions may be considered when other treatments have not provided relief. Joint replacement surgery, such as hip or knee replacements, can reduce pain and improve function. Arthroscopy, a less invasive procedure, involves inserting a small camera into the joint to repair or remove damaged tissues. Complementary therapies, such as acupuncture, massage, and yoga, can also be beneficial. They can help to manage pain, improve flexibility, and reduce stress. Remember, it's essential to consult with healthcare professionals before starting any new treatment regimen. They can provide guidance based on individual health conditions and needs. Arthritis management is a lifelong commitment. It requires patience, perseverance, and a proactive approach. But with the right treatment plan, it's possible to manage symptoms effectively and maintain a good quality of life. The goal of treatment is to reduce symptoms and improve quality of life. Living with arthritis? Here are some practical tips and resources. Incorporating regular exercise into your routine can significantly help manage symptoms. This doesn't mean you have to run a marathon. Low-impact activities like swimming or cycling can be beneficial, keeping your joints flexible while strengthening the muscles around them. Maintaining a healthy weight is another crucial aspect. Extra weight equals extra stress on your joints, especially your knees, hips, and spine. So strive for a balanced diet rich in fruits, vegetables, lean proteins, and whole grains to keep those extra pounds at bay. Managing stress effectively is also paramount. High stress levels can exacerbate arthritis symptoms, making them feel worse. Consider mindfulness practices like meditation, yoga, or deep breathing exercises. And let's not forget the importance of assistive devices. Canes, walkers, or raised toilet seats can make a world of difference in your daily life, helping you maintain your independence and functionality. But remember, no one should navigate this journey alone. Seek support from healthcare professionals who can provide personalized advice and treatment plans. Moreover, connecting with arthritis communities, both offline and online, can provide a sense of belonging. You can share experiences, advice, and emotional support with people who truly understand what you're going through. Arthritis may be a part of your life, but it doesn't define it. You have the power to manage your symptoms and lead a fulfilling life. Remember, you're not alone. There are resources and communities ready to help. We've covered a lot about arthritis today. Let's quickly recap. Arthritis is not one condition, but a collection of joint diseases and conditions characterized by inflammation and pain. There are many types, including osteoarthritis, rheumatoid arthritis, and psoriatic arthritis, each with its own set of causes and symptoms. Factors like age, genetics, obesity, and joint injuries can increase your risk. Common symptoms include joint pain, stiffness, swelling, and decreased range of motion. Diagnosis usually involves physical exams, imaging tests, and blood tests. Treatment options are wide-ranging, from medication and physical therapy to lifestyle changes and surgical interventions. Everyday management can be improved with regular exercise, maintaining a healthy weight, managing stress, and using assistive devices. It's also crucial to seek support from healthcare professionals and connect with communities who understand your experience. Remember, take proactive steps to manage your arthritis. Your health is in your hands.